Chances are you've met at least one person in your lifetime that's experienced a seizure, and you may even know someone who's living with a diagnosis of epilepsy every day. As reported by the CDC, 3.4 million people are diagnosed with epilepsy in the United States. I would like to take this opportunity to discuss the diagnosis and the treatment of this very common disorder, as well as some of the challenges those living with epilepsy face every single day. So, what exactly is epilepsy? Epilepsy is a disorder within the brain that causes seizures due to abnormal electrical activity. The seizures can be described as clinical or subclinical, clinical being what me or you could see with the naked eye. Those are most likely the ones that you hear about where the patients are shaking, foaming at the mouth. Subclinical are a little more difficult because those are seizures that patients can have up to 100 times a day, and someone like you or I would never even notice. Seizures can be caused by many factors, and they can affect all genders and races. Events that many of us experience daily, such as low blood sugar from missing lunch, high blood sugars with our diabetics, really high temperatures when we get our colds, and chronic stress, all of those can cause like a one-time seizure. But a one-time seizure doesn't necessarily give you a diagnosis of epilepsy. In contrast to the one-time seizure, many epilepsies are normally caused by things such as like structural abnormalities in the brain, tumor, stroke. You can have traumatic brain injury when you get into car accidents. Those are primarily what cause your epilepsies. But with that being said, over half of epilepsies go without a cause. The doctors aren't able to find out what caused it. They just kind of develop later on in life. One of the most reliable ways to diagnose seizures is with something called an EEG or an electroencephalogram. That's actually something that I do every day in the hospital. We do it in the inpatient and the outpatient setting, and it can be done in the OR. There's also other diagnostic tests such as MRI, CT, MEG, PET scans, SPECT scans that can be used in conjunction with the EEG to get a better picture of the brain and what's going on. But one of the major differences between the EEG and the other types of imaging is that where the EEG can show actual electrical function of the brain, the others only show structural abnormalities and how they may be causing seizures. The primary course of treatment for epilepsy is by anti-epileptic drugs. That's normally where the doctors will start. And there's currently 15 on the market. As noted by the Epilepsy Foundation, no one medication dominates for effectiveness, and all have various side effects, and most of them are not good. Sadly, even with the large variety of AEDs that are out on the market, there's still a large chunk of people, and Stanford actually mentioned that it's 1/3 of people with epilepsy will still eventually develop something called intractable epilepsy, and that means that the medication doesn't work well or doesn't even work at all for these patients. And for these individuals, surgery is normally their only path to having a somewhat normal life. Whether the patient's epilepsy is responsive to the treatment or intractable, anyone with epilepsy is sure to face some sort of challenge in life. Most individuals have terrible depression due to their limited social lives. I mean, they can't stay up late and party, they can't drink. It's just, there's so many things that are risk factors for patients with epilepsy. Going to amusement parks, a lot of things that you would go off and do with your friends, you're really limited to do when you have epilepsy, and you get kind of shut out from those activities. And it can be really lonely. Most individuals, we take for granted a lot of those things. And even things just as simple as being able to get up and go drive to the store. Because as we know, most people with epilepsy, depending on the type, they do not have a driver's license. They can't just get up and go when they want to. So with that being said, I'd recommend that the next time you hear of someone having epilepsy, remember that even though it's a really common disorder, it's an extremely challenging and lonely disorder to have. Thank you for your time and have a great day. Bye-bye.